Hey, good afternoon, everyone. Thank you so much for joining the conversation. Today we're going to be talking about COVID-19, the pandemic, and our children. Before we get too deep into the conversation, there's some just amazing questions and incredible mothers here on the call today. I just wanted to pause for a second and allow everyone to take a deep breath, because we're now almost exactly 4 months into this world-changing event, this pandemic. We're actually 6 months since the introduction, 6 to 7 months of the disease to the world, and 4 months since lockdown, since we've begun responding to the coronavirus. And so pausing for just a moment and just congratulating yourself, each of the moms on this call, and anyone who might see this, for getting through this, for surviving, for as I think about it, our ancestors, our forefathers, that's what they did. They survived. They survived big challenges, big confrontations to our life and our way of life, and they kept going. And every parent and child that I see now, I just applaud everyone for their resilience and their ability to get through this and to survive it. And yeah, we're going to talk about some details, some specifics about ways we might approach things. But take solace, take heart in the fact that you all are doing it every day. And then the other thing I'll say, like as a caveat before we begin too deep, is that in some ways we're in a world of gray, right? Prior to March, we may have had we have concrete answers about most things, and now we're in such a world of gray that giving each of us some grace and cutting ourselves some slack will be super important. So my name is Krishnan Subrahmanian. I'm a pediatrician here at Hennepin. I'm also the father of 2 little ones. I have a 4-year-old and a 2-year-old. And, my wife works out of home, and our kids have been at home the vast majority of the time. So really struggling with a lot of the things that I think we all are. And so I'm just grateful for you all taking the time to share with me so that I can learn as well. So thank you so much.
I can go next. Thank you for those words. Very helpful, very comforting as we try to balance, integrate work and home. My name is Melissa Buffalo. I'm an enrolled member of the Meskwaki Nation in Iowa. I'm also Dakota from the Crow Creek and Lower Brule Sioux tribes in South Dakota. On this call, just to have conversations and hear other parents. I do have an 8 and 9-year-old, so full-time worker, full-time mom. We just finished summer school, so thinking about what's happening come September, August for our kids. So excited to be here for these conversations and time with you.
I can introduce myself next. My name is Amy. I have an almost 2-year-old daughter, and she has been in daycare since the beginning of the pandemic. So we have lots of questions about COVID and life with a toddler.
Hi, my name is AZ. I have a almost 14-year-old daughter and a 5-month-old baby. So questions about their age groups. And then I'm also a teacher for Minneapolis Public Schools, and thinking about my health and what I should be thinking about going back potentially teaching in the fall.
Well, thank you all so much for joining. And while your children won't say a big thank you for getting them through this time for a long time, it's probably 20 years from now, just thank you for everything you're doing. It's from teaching to mothering to working to everything. It's incredible. So thank you, and I really look forward to the questions. And I promise you, I will be listening to you all for answers as well, because there's a lot of wisdom here.
Okay, so the first question I have are, what are those things that are considered safe during COVID and keeping close to home for our kids? And how many kids can I allow in my home?
Yeah, so this is a little bit back to that conversation of the gray. I wish everyone would be, whether it's policymakers, public health experts, would be a little more transparent in the sense that this is an illness where we're learning so much about every day, every week, and so as we think about what are the things that are safe. There's one end of the spectrum where we sequester ourselves in our houses and we don't see anyone except for the immediate family, and we don't venture out. That's one end of the spectrum. The other end of the spectrum is going out to a club with 1,000 other people and getting close and having a lot of contact. So we know that the one end of the spectrum is the one sure way. Like if you stay inside your house and no one has COVID, then you're not going to get COVID. At the other end of the spectrum, if you're going into places where there's a lot of people and many of whom could be ill or have symptoms, the chances are much higher, right? But everything else in between, I think, falls in a little bit of a gray area. And so the things that I sort of talk about in terms of guidelines, in terms of suggestions, are just some big general rules. And I'm happy to go into more specifics too about specific activities. But one, we know that masks are helpful, and they're helpful in terms of our transmission to other people. If we have minor symptomatology, asymptomatic COVID, it helps us from transmission. So I always say masks are better than no masks. I would say outdoors events, because of the fact that the virus in air can dissipate a little bit more, it's more space. Outdoor events are better than indoor events. Social distancing, 6 feet and greater is better than close proximity. And then smaller groups are better than bigger groups, right? Finally, I would say if we're going to be close to people, less time rather than more. And so those are very broad strokes comments, but I think they provide sort of the spectrum. So when it comes down to the question of like how many people, right? On the far end of the spectrum, if you want to assure absolutely no exposure, it's your immediate family. But as we expand our circles, as we expand our connections, I would say I would bring smaller groups at a time rather than bringing all your children's friends over at once. Maybe bring one family over who you can be sure of has no symptoms currently, and then trying to do something that's structured outside a little bit more than inside. I recognize, and I think we're going to come to some questions about masks in particular. Masks for kids sometimes can be hard, but if you have kids who are older who can do masks, that is a better thing. And then setting both some limits and rules. I think it's really important to have conversations with other parents and other community members about, these are our rules. This is where we feel comfortable. And that can sometimes mean, we're going to keep the kids 6 feet apart if that's at all possible. And sometimes that means we're going to make sure we're hand washing every 15 minutes. We're putting some gel on their hands every 15 minutes. Whatever rules you have, I think it's really important to be clear with them to the other family and vice versa. The other two big questions I ask myself when it comes to events, and we're all being challenged with, there's an event going on. Is this the event to go to? One, I would sort of put it on your own, how important is this? Is this honoring an elder that you have to do? Is this a wedding? Is this something that's really, really life important, right? Is this versus, something that's less crucial to get done in the short term? And then I would also ask, what is our risk for my family? So do I have someone who's an elder in my home? do I have someone with a lot of comorbidities, and when we think about morbidities with COVID, really, do we have people with hypertension or diabetes in our home who are at greater risk? And I would put those as cautions for myself, making a higher threshold for an event to happen. So, gosh, I don't want to underemphasize the importance of socialization and having our kids see other kids, whether through FaceTime, whether through a distance. It is important, and we need our young people to come through this mentally sound and resilient as well as physically sound. But I would just weigh out all those sort of criteria. And if you can come up with a list of guidelines for yourself and your family that keep them safe, then that's awesome. And just be eager and willing to share that with your other family that you're going to meet. So fewer the better, I think is the answer. But you can do it in more safe manners. Is that helpful? Does that get to
that's extremely helpful. Thank you.
Okay.
Yeah. So I am flying next week. I will be on a plane. The baby, my partner, my 14-year-old, we're going to have the face coverings, the shields on our face, but beyond, having, we have the 5-month-old baby, what extra steps can we take to try to distance him from germs and whatnot, and while we're on the plane, is there anything extra that we could do for him?
Yeah. I'm hearing that the baby's 5 months old. That actually makes me a little happier because under 3 months old, we get very scared about temperatures in babies. It's a sort of a cutoff that under 3 months old, we get super concerned, and you need a lab workup with a fever. So over 3 months, it's not, obviously we care deeply about fevers and we worry about fevers, but it's a little bit less, we jump to getting labs and all. So I am happy to hear that the baby is over 3 months, and congratulations on a 5-month-old.
Thank you.
It's a lot. It's a busy time for you all. So yeah, the things that I would think about if I was going to be traveling right now. First, when you get to the airport, ask if there is any way for you. And obviously, you're in a smaller contained area in an airplane, right? That's an obvious thing. Ask if there are any seats that are a little bit further away, and the worst they can say is no. But they might be willing to help out a small baby and a family, and I think it's always worth asking. So make that ask. You can blame the pediatrician and say he asked if there was a space where that you all could go within the plane that was a little bit further away. I think that would be nice. You already mentioned this, but I would always say masks for everyone over the age of 2, because obviously that's protective. Bring a few extra masks in case there's some person on the plane who decided not to. I think most airplanes are requiring you to wear one, but bring a couple extra just in case. Or if there's someone in the airport who's you can offer, and they may or may not take you up on it. But I would say, obviously, if you hear someone coughing, if you in the airport, if you hear someone with symptoms, or walk away, take some space from them. You had mentioned that you're going to go travel, and you're going to be meeting some friends, some family. Where are you?
Yep, we're going to be meeting some new family members. So some of the thoughts we had were, obviously if you have any symptoms, to not, don't come over and meet the baby. If you're feeling okay, we're asking everyone to, wear a mask, wash their hands as they come in the door. We're staying at a family member's home who's, done the same. They sort of stayed in their home this whole time, and when they leave, they wear a mask. So sort of the same thing that we've done.
Yeah. No, those are just awesome. The same kind of screening questions you would have as you enter a public building these days, or as you enter a clinic, are the same kinds of questions I would pose to your family members. Fevers, cough, any symptoms. I would actually call them probably now, if you're leaving in a week or so, and say, hey, to the extent that you can, and I know this is not possible for everyone, but if you can sequester as much as possible for the next week before meeting and seeing the baby as a favor. I think that would be nice. I understand it's not always possible, but it
Right.
allows less contacts to be in contact with baby, if that makes sense.
Yep.
And then, so yes, screening questions, if you will, before arrival. I would do two other things. You're doing a lot of great things to try to mitigate the risk. Two other things that I would do: just bring a ton of hand gel and be slathering the kids yourselves. Wipe down the surfaces, and I know the most common way of transmission is airlet respiratory transmission, but hey, let's be a little extra cautious while we're on an airplane. So yeah, wiping down surfaces, bringing lots of hand gel. The other thing I would do is if you're going to go meet elders or people with comorbidities, just have a conversation with them and tell them what I tell people is, mostly I'm worried about your health, and I just want to make sure you're really safe. Keep in mind we have two little kids, and little kids sometimes have germs, and I just don't want anything to be transmitted. If you just have that conversation ahead of time with people who might have any comorbidities, higher risk, elderly, just to protect them. And I will say, in these situations, it is the elders that I'm thinking about a lot.
Okay, that's super helpful. Thank you.
Yeah, no, thanks for the great question.
So how can I support my family's mental health during this time? And I'm not working now, but it was, and I could potentially be teaching from home as we go back. So just how can I be supportive of my health and family's mental health, and a daughter who, should be starting high school, but could potentially be starting high school from a computer?
Thank you for the question. So first, I would say acknowledge to everyone. Be honest with the family members that this is not normal, and be honest with yourself that this is not normal. I think that when we expect parents to always have it 100% understood and together, I think that's like not a fair expectation, because this is a life-changing experience for all of us. This is a world-changing experience for all of us, and so just recognizing that we are in the middle of that flux and that change, and we're all learning. So first, that grace, that calm, that understanding that this is really hard is so important. So what I think about in this is, first, our first job in terms of supporting mental health of families and ourselves is to, one, just celebrate your health, and every day take a moment to celebrate the fact that you're healthy, or other people in your family are healthy, and celebrate that. That's a big step in this day and age. Two, celebrate the fact that you got through the day, that you kept the kids relatively fed and changed. Celebrate that. That is not to be taken for granted in this day and age. So like, honor yourself in some way, whether that's a moment of pause, a moment of reflection, whether that's a treat, whatever it might be, honor that, because it's huge. The specific things that you can do for your kids are sort of as follows. Well, one, provide as much structure and routine as you can, recognizing that these structures and routines are changing as school schedules change and all that, but provide them some structure and routine just so that the days have meaning. That we wake up at a certain time, generally speaking, we do certain activities that we want to get done, and allow your kids to drive. What are those things that make up their schedule? Let them help construct that routine or schedule, generally speaking, and then allow the flexibility. So routine, schedule, but allow the flexibility that comes along with this ever-changing time. Two, and this gets back a little bit to what I first said, is role model. And by role model, I mean role model self-care, role model taking pauses, role model asking questions about this illness. You all are sort of definitionally doing that here today, but like just role model saying, I don't know the answer and what's happening right now with the illness, but I'm going to explore. I'm going to ask questions. I'm going to find good resources online or elsewhere that help me answer those questions. And I'm also going to role model ways that I can be useful and helpful in this world today. And I know that's a different meaning for everyone, but if you can role model those elements, that's the biggest thing. I think about this as a really striking challenge. But when kids see that parents come through the challenge and come through a little bit wiser and a little bit stronger, that is a huge lesson in terms of resilience for the long term. We don't know what the next big challenge is that our kids will face. It could be personal, it could be health-wise, it could be social, but recognizing that through bad things, we can come out stronger is a huge deal. And we can show that through these simple, not simple things, these hard everyday things of taking care of ourselves, asking questions, searching out answers together with your children, and then finding ways that we can be useful and helpful to our neighbors. I think that's a big element. Two more quick points that I would say: give them what control you can. This is an illness, this is a pandemic that has taken away a lot of control from kids. Any opportunity you can give kids choice and control is huge. So that comes down to schedules, that comes down to, we'll talk about masks, that comes down to how, for some kids, it's how do you want to prepare your meal today, right? We're preparing meals. How can I give you some agency in that is a big deal. And then the last thing I would do is just be watching your children. And, one of the disguised blessings of this pandemic is that we sometimes are spending a little bit more time with our kids. And just watching for those changes in behavior, sleep disturbances. I think almost every child is having some challenge and some anxiety, some nervousness, some sadness over the loss of experiences. Watch out for those signs and allow them the space to express themselves and talk with you. One of the biggest elements of getting through challenging times is strong relationships. If a child knows there is a relationship in their life that they can go to and access through a challenging time, that is a huge deal. So just invite that space. And if you need to, structure it into your daily life. Say, this is our 8 p.m. check-in or our 5 p.m. check-in or whatever it is, or dinner time. We're going to go around the horn. We're going to go just check in with everyone in our family and say, hey, how's everyone doing? And it's okay to say, I'm not okay.
This is Amy. I'll jump in with a couple questions here. And this has been really helpful so far. And we touched on my first question a little bit, but I know that you've got a young toddler as well. And so I'm kind of wondering guidance on when she's supposed to start wearing a mask in public. We have not done that yet. But any suggestions for getting a toddler to keep a mask on? And if I have to take her into a store and things like that, when should I be doing the masking with her?
Yeah, it's a great question, and frankly, it could apply to adults too. How do we help adults keep their mask on too? It's really challenging, right? One, acknowledge that the masks are hard, and they're not normal, and they can be uncomfortable. I think for us, recognizing that there are barriers, there are inherent barriers to masking is important. That being said, I think for toddlers in particular, there's a few things you can do to help. One is in the spin of how we present the mask, right? It's it's, wow, you have the opportunity to be a superhero. You have an opportunity to help out and protect everyone from the germs. And all you have to do is wear your protective, gear or shield or mask or whatever you want to call it, right? Framing it in the terms of like, this is awesome and this is an incredible way to help out other people. I think tying in and buying into the empathy that children have, that like, we want to protect our elders, we want to protect our grandma from these germs, and this is one way we can do that, is big. It's not going to get you all the way there, but it's a big element. The other things I would do are a lot around this concept of choice, right, and like empowering young people with choice. So go to the store with them and allow them to pick out the material or the mask that they want. Allow them to choose what it is that they want. If there's a lot of sites, whether it's, Amazon, Target, whatever, there's lots of sites. And they have a lot of selections of masks, and some of them are actually kind of cool. I did some exploration yesterday, and they're superhero themed or, whatever cartoons are out there. There are masks in that flavor, if you will. Allow them to choose and allow it to be a big, exciting thing. That, oh, yay, the Minnie Mouse masks are coming, or whatever it might be. The other thing that you can do is there are blank masks, like there are blank slate masks that you can actually have them design in color and paint, and I think that's a really exciting opportunity for kids to design and build something that they might be able to use, and I think that's fun. It can be a really fun, nice thing. So I think making it as fun as possible is important. And then I would also say, like, let them know that when we go to public places, that's the expectation for kids, for anyone who's a big kid, right? Anyone who's over 2 years old who's a big kid, then all big kids get to wear a mask, right? So like, and I think that helps frame it for toddlers in particular who are looking to assert their big kiddedness. I think it's helpful to frame it in that way as well. If you can make masks together, that's super fun too. And then have a few different, when you go out, have a few different masks, so that the option is when they are unhappy with the mask that they're wearing, say, okay, you don't want to wear the Paw Patrol mask, here's the mini mask, or whatever it might be, right? And that way the option isn't mask or no mask, the option is this mask or this mask. And so you still present them with options, you still present them with like the way that, something that they might like, but a little bit more choice in the matter. All that being said, I go back to my initial point that masks are hard, and I get that. We do generally recommend kids over 2 to use them, not necessarily under 2, particularly small babies. It's obviously you don't want to obstruct any breathing for small babies.
Makes sense. Thank you. Those are great ideas. And my other question was, and thankfully this hasn't happened yet, but if I get COVID-19, how do I care for my daughter? Any guidance around that?
Yeah, so we've run into this quite a bit in the hospital, particularly with moms who have just delivered and who have had COVID. So we do have some experience with this. Well, one point of solace that I haven't brought up yet, but I want to make sure that I emphasize. We're so lucky that this pandemic has not affected the physiology of kids in the same way that it has affected older people. Luckily, this disease is not killing children in the same way it's killing older people. I think to date, 0 children under the age of 19 have died in Minnesota, and it's a very similar number nationwide. I believe 2 young people between the ages of 20 and 29 have passed away. So we are, while we are horrified by this disease, it's a small blessing that it has not affected the young ones in the same way. So know that when you talk about this scenario of you getting COVID, my initial reaction is I'm actually very worried about you, right? I'm very worried about moms and elders, and I'm very worried about any grandparents that might be visiting you. I am worried about your child, but I know that their physiology is going to do better. So just keep that in mind. Now, how do you care for them? When someone is diagnosed with COVID, we would ask that to the extent possible, you self-sequester. And this is assuming, obviously, that you have COVID and your child has no symptoms and the rest of your family doesn't. We would ask that you self-sequester, stay away when you are in contact, wear masks, wash hands like crazy, have everyone in the house wash hands like crazy, probably isolate to a room where you can take care of yourself. The general advice is you're doing some self-quarantining for 10 days beyond the start of symptoms and 3 days beyond the end of symptoms. That's the very general advice. And then I would say, if you are breastfeeding or responsible for the feeding of the child, that is okay. You should breastfeed. You should give food to the child. But they would just say limit it to those times if you're breastfeeding. Breastfeed, wear a mask while breastfeeding, and then have baby go back to the other caregivers of the house. So it's just trying to limit contact if you happen to be the one person in the household who has COVID symptoms.
Hi, Dr. Krish. I have a couple questions.
Yes, please.
I think first, thank you for thinking of the parents, and as we think about bringing our kids in. So, our mental health is just as important as our kids. So I thank you for pointing that out. But you touched on this a little bit, but can you maybe talk about maybe some more of those steps as we think about being a mom with a new baby or wanting to go see a friend or family member that has a new baby? And, what are some of those extra steps we can take when meeting a baby for the first time?
Well, wonderful. Yeah, what a joy, right? And it's so it's quite a monumental time to have a baby. We're welcoming life into this world, and it's such a joyful event. And I know it's complicated by all that's going on around us. And just know too, I've been blessed to see a lot of moms over the last couple months, and it's hard on moms, right? Like it's hard on moms of new babies. So I do think that there are a lot of moms of new babies out there who are eager to have you reach out. They're eager to have whether it's a call or a visit or something. That would be a lovely thing. The first point, and I this is sort of obvious, is just reaching out to mom and saying, one, how comfortable are you? And don't be polite with me, right? Don't be polite. Tell me honestly, like how comfortable are you with us either coming over or visiting or because I think many people are polite and will just say yes. When in their heart of hearts, they're not as comfortable. I tend to be very cautious, and I tell parents to be cautious for any baby under 3 months because of what I spoke about before. Any fever leads to lots of labs, and I don't want to poke a baby if we don't have to. Yep. So under 3 months, I just take extra caution. Then I would sort of talk to a mom and say, what, I have no, being clear about, we have no symptoms or we have no contacts with COVID. And if you do, please, honor the baby and take some distance until everyone is super healthy, right? So those are huge things. Ask mom, ask family, what are the ground rules that you have? What are the ways that we can be respectful and helpful and protect baby as best as possible? The things that I would offer and that I would do if I was going to see a baby that, and like I said, I would probably only be doing that in the case of someone very, very close and for whom I knew that I could be helpful by visiting. But I would bring masks, obviously. I would bring gloves. I would not kiss the baby. I would not, snuggle. And back in the day, maybe a year ago, I might have, right? I might have snuggled baby with mom's permission. I might have given a big hug. I probably wouldn't do that now. I would, just to be super safe. I would, go with my mask and my gloves, and I would offer to be helpful in the ways that I could. What are the things around the house that I could do? What are the things that you need picked up from the community? What could I do? I think that would be a super meaningful visit. And then going and seeing the baby and sort of honoring their spirit, honoring their life, and saying hello, and trying to do that in as socially distant manner as possible. In this situation, especially, the smaller the baby, the more I would emphasize this. I probably wouldn't bring other kids.
Right.
Because telling them to stay away from baby is really hard, right? Like that's not a rule that registers oftentimes. So just people who could really follow those rules are people who I would bring. But otherwise, yeah, I think obviously it's just a heightened level of vigilance. But I will say it's also a heightened level of need amongst parents. And so if you can, for anyone out there who has a friend or a family member who has had a baby, do a FaceTime call, and do that frequently. Call them, reach out, or as frequently as they want, but call and reach out, because I think there are ways from a slight social distance that we can be helpful in this day and age, because it's hard. Grandparents frequently are not allowed or are not coming and helping in the way that they have in the past because of the fear of the illness. So if there are things that we can locally do to help our neighbors, that might be nice. In our situation, my mom lives in Texas, and so she would not come if we were to have a baby. But we would then rely on our neighbors so much more. So it's really a time where we can be helpful to new moms and dads.
One more question, again, thinking of our new moms, but for babies. And then also, as I have an 8 and 9-year-old, about, as a pediatrician, we think about when is a good time when do you want to see kids if they're just coming for their annual physical? My daughter will be 9 here in September, so 10. So when the pediatrician?
Yeah, so, we have opened up largely to child checks, to all visits for the most part. And so we would be thrilled to see the kids. I would just make sure that you are comfortable and knowing of what are the guidelines at the clinic, and make sure you're happy with them. If you're not happy with the level of security and safety that a clinic is putting into place, don't go. But I will say, from the perspective of the clinics that I work in, we're sort of sequestering all our healthy people into one side and one entrance, and then anyone with any COVID-y symptoms go to another entrance and another side of the building. So, there are some changes being made to the way we do that. Also, for some time, and we still are limiting the number of visitors that can come with a child, just to keep fewer people into a clinic visit room. So, and then, as a provider, we're wearing masks and shields with everyone, and then as patients and as guests, everyone wears a mask. So there are sort of things being done to try to mitigate spread. But yeah, I think as we recognize, we're probably in this for more time, right? We're probably in this for the next 6 months to a year until either a vaccine or herd immunity is attained. I think it's, what are those important things? If it's we need to get a vaccine, we need to have a visit to the doctor, then you can do it, and we'll just do it in the safest manner possible. It also might be worth it. Almost every health system around the Twin Cities is doing a lot of e-visits now. So feel free. I would take advantage of it, surely, that if my child had a concern, I would do an e-visit first. And if it was sort of stated by your provider that, oh, no, I think we really need to see you, then we can do that. Like we can always bring you in for a in-person visit as well. So I think the e-visits are a really nice first step if you're uncomfortable, or if you just want to have a better knowledge of what the next step is. So yeah, did I answer the question?
Yes, thank you.
Okay. I think many years from now we'll look back and we will be telling the stories to our children about how we got through this, and so one of the things that I sort of really reflect on is try to do something every day with your kids. 5 minutes, 10 minutes. Try to do something, whether it's building a fort, whether it's going for that nightly walk. Try to do something that will not only build their resilience, but will also be the good memories that we take from this really trying and special time. You all are amazing. Congratulations on doing so well with your little ones. And yeah, if you all have further questions or concerns, please feel free to reach out to me or to any provider. I'm sure we'll be thrilled